Hi everyone, in this video we are going to discuss about nasogastric tube insertion. So the nasogastric tube insertion definition is administration of feed directly into the stomach through a tube passed into the stomach through the nose. That is a nasogastric. If it is passed through the mouth means that is called as a orogastric. So here the patients in the hospital as well as home care settings often require nutritional supplementation with enteral feeding. So the enteral feeding can be administered via nasogastric or nasoduodenal and nasojejunal means. The focus of this clinical practice guidance is on the nursing management of nasogastric tube feeding. So here the nasogastric tube feeding may be accompanied by complication that it is important for the practitioner to be aware of how to prevent it. So the next we will be move on to the purpose. So what are the purpose we are going to give a feeding? So the first one will be the to provide adequate nourishment to the patients who cannot feed themselves. So it may be a younger child or it may be older people more than 80 years of age. We will be go ahead with the NG tube and to administer the medications. So some people they won't take medications by oral means, like some psychiatric people, for those people will be administered with the NG tube feeding. And next, to provide nourishment to patients who cannot be fed through mouth. So example is the surgery in the oral cavity, unconscious or coma state patients. Here the surgery in oral means whether it may be a cancer, oral cancer, or they may be any tonsillectomy surgeries, or they may be any radiation therapy in the mouth cancers. For all those things we will be giving. So apart from that, there will be a bariatric surgery also. For the management of the obesity, they will be go ahead with the partial or complete removal of the stomach. So that time also we will be go ahead with the nasogastric tube feeding. Okay, so these are the some purpose of administration of nasogastric feeding. So the next one is indications. So to whom we have to be provide this NG feeding means first one will be the head and neck injuries. Those who are having a head injury because of RTA, that means road traffic accident, any spinal cord injuries. So those people they can't able to take food by mouth means we will be go ahead with the NG tube feedings. And coma patients, definitely the coma patient can't able to take a food by a mouth. So the next one is obstruction of esophagus or oropharynx. There will be any cancers, there will be any infectious, any pharyngitis or laryngitis. So these type of problem will be go ahead with the NG2 feeding. Next one is a severe anorexia nervosa. So anorexia nervosa means it's one type of eating disorders. The particularly it will affect the female. They will be neglect to take the food because they may have a fear of obesity. So that time they will avoid a food. They won't take 2 tablespoon also per day. That much severe when it will be going means that time we have to start the NG tube feeding for the severe anorexia patients. So that is one type of eating disorders. So the next one is a recurrent episode of aspirations. So aspiration means when they will be taking a continuous food, that food will be get into the lungs. So continuously when it will be get into the lungs, the patient will be go for a pneumonia, and so many life threatening conditions will happen. So there will be some spasm in their larynx and that esophagus. So because of that, the person will go for the aspiration of food to the lungs. So for those patients also we will be go ahead with the NG tube feeding. So the next one is increased metabolic needs, burns cancers. So here when their need will be more but the intake will be less means we have to be improve the intake, we will be go ahead with the NG tube feeding. And cancer also. So we have to give a lot of liquids for those who are undergoing the radiation therapy and chemotherapy. We have to replace it. Next one is a poor oral intake. Particularly it will be for the elder age people and those who are in the final stage. There will be very poor oral intake. That time we have to administer the NG tube feeding. So that's all about the NG tube insertions. Thank you everyone.